Hello, my name's Ria Rosser. I'm one of the consultant colorectal and general surgeons at Chesterfield Royal Hospital. That means I'm a doctor. I mostly do operations, sometimes planned operations and sometimes emergency operations. And then I'm responsible of looking after the patients before they go for their operation and afterwards. I also do consultations where I explore people's symptoms, what they might be worried about, and endoscopies, so camera tests within a person's large bowel. As I left school, finished my A-levels, I already knew that I wanted to go into healthcare and I knew that I wanted to do medicine and I knew that I wanted to be a doctor. The reason why I chose that was because during A-levels I enjoyed the sciences. As at A-levels I did biology, physics and chemistry and general studies, and those were the A-levels that were required to start studying medicine. Then I went to medical school, and usually medical school is 5 years, but there are degrees that you can do in between, other things that you can break off to do depending on your interest. So in general, medical school is 5 years, and then you start off as a junior house officer, and it's called an F1 grade now, and you go through different specialties. So there are different types of doctoring that you can do. There are surgical type jobs, there are medical type jobs, and that's to see what kind of doctor you want to specialise in, what you want to focus on becoming. Everybody goes through this first year regardless of whether you want to be a general practitioner or whether you want to work in hospital or whether you want to be a pathologist, so that they're exposed to all the different specialties. And you progress up the grade and you do an F2 year, and then by the senior house officer years, which you normally do for 2 or 3 years, you specialise and you focus on the kind of career path that you want. So that's for 3 years. And then as a registrar, that's usually for about 5 years, depending on the specialty, and you just do the specialty that you've chosen. So that might be respiratory, which is looking after people's breathing, cardiology, the heart, or surgery. Usually that's for about 5 years. And then you become a consultant after that, but there are exams and courses that you have to do along the way. I knew that I wanted to work in healthcare. I knew that I wanted to work with people. In my line of work, I meet somebody new every day. I get to find out about them. I'm very privileged that they will tell me how they're feeling, whether they're feeling unwell. People let me into their circle of trust, I would say, and that's a very privileged position to be in. I think it's a wonderful organisation to work within. The people that I work with and alongside, so supportive, so friendly. Everybody has a common goal, which is what's best for the patient. There are ups and downs, there are some sad cases, but there are lots of uplifting cases, and even if it's a bad prognosis or a bad diagnosis, our job is to help somebody get through that in the best possible way that we can. And that's very rewarding. Being a doctor, I enjoy. I wouldn't change it, and if I could choose again, I would definitely choose to be a doctor again. And if you have the opportunity to work in the NHS, I definitely recommend it.